My name is Enid Banton, and we are here to discuss tonight information about the COVID-19 vaccine. And we've been fortunate enough to have join us twin sister doctors, I believe that's the name of the organization, actually, or the website, Delana Wardlaw and Dr. Elana McDonald. Joining them will be Dr. Kito Lord. So we thank you all for joining us and coming to the Cheltenham community with information that will make us wiser, more knowledgeable, and more informed about the COVID-19 vaccine. We are welcoming questions from the audience, so use the chat. We will collect your questions and get instant, not so instant answers, but answers at the right time. We're first going to start off. We'd like to explain to those who don't know about Cheltenham African American Alliance, who we are. We're going to hear from our chair, Brent Ryan, and we're going to hear from Keisha Derry as well about Cheltenham African American Alliance and what we've been doing in the last couple of months and how we've been partnering with the schools, with families. So I'll hand it over to Brent.
Thank you, Enid. And welcome, everyone. Thank you for attending this community conversation. We're very happy to have you here. This is our second one, and the last one was such a great event, and I'm looking forward to having the same type of enthusiasm and same type of questions this time, so I'm excited. Just a little bit about our nonprofit. The Cheltenham African American Alliance is an organization created from educational improvement of African American and African diaspora students in Cheltenham School District. We aim to be of service to families as we strive to promote engagement and close the access gap to resources, programs, and the many opportunities offered by the district. The Cheltenham African American Alliance is organized exclusively for education, advocacy, and charitable purposes. So far this year, we've had our challenges, obviously, as we all have organizationally, in terms of the pandemic and what we're facing, but we've been able to still mobilize and do some great things. I believe we have a slide of some of the things that we've been done, but I know that you see here in the upper left-hand corner, we were able to raise money for our families in Cheltenham with a bike-a-thon. That was our first bike-a-thon. We will be walk, run bike-a-thon. We will have another in the spring. And it's us obviously encouraging people to get outside and move and to be healthy, but also to contribute to a positive cause as we help families of color navigate through the school district and provide opportunities for them. In addition, we've provided free college essay workshops for our juniors and seniors at the high school, where we've had them work with a writing coach to help them prepare their college essay and help them with admittance to college. We've obviously done bike giveaways and toy giveaways, and most recently, we've done protection kits for all of the schools in our district, where we just volunteered to donate wipes and sanitizers and things of that nature to help them with their resources. And so those are just a few of the things that we are doing. Obviously, at our core, we are about advocacy and assisting families in their navigation through this district. And so if you are a Cheltenham family and you are in need of any of the resources that we offer, please don't hesitate to contact us. If you could, Kelly, if you can go back to the slide so we can get faces to names of the people who are on our board. You'll see that there's myself as president and Keisha Derry as vice president. Our outreach chair and advocacy chair is Enid Banton, who you'll be hearing a lot from today. And then our educational chair, Eben Ingram, are the people that you primarily will be in contact with. And so if you see these folks around the community, please don't hesitate to approach them and let them know if you have any needs. All right. Thank you.
All right. So getting into tonight's topic, I know our communities in particular have a lot of questions. If we can be transparent, if we can be real, we don't have the best reputation when it comes to government and just things like this. So a lot of us have some skepticism, but we also know that we're in a pandemic. I'm sure many of you, if not directly, indirectly know someone who has been impacted by COVID-19. And as you know now, there's a vaccine or two vaccines approved here where we are that is being offered to us. So we just felt, our goal tonight is not to sway either way. Our goal is to give you the information, to give you accurate information, not YouTube or what my cousin said, or to give you accurate information with informed professionals who deal with this virus every day. And from here, hopefully you move forward in the best decision, in the best way you feel is best for you and your family. So with that being said, welcome to CAAA's community conversation titled, What's the Real 411 on COVID-19 Vaccinations?
All right, so we are fortunate to have twin sisters, Dr. Delana Wardlaw. I don't want to say word, it's Wardlaw, and Dr. Elana McDonald. These are actually nationally known doctors who speak often. They were just on the Black News Channel before they joined us. That's how blown away I am that we were able to even get them to come tonight and talk to our community. And that's how hard we are working for our community to bring credible speakers on these topics to talk to us. So let's learn about the sisters. Dr. Delana Wardlaw and Dr. Elana McDonald are African-American identical twin sisters hailing from North Philadelphia. So right here in Philadelphia, we have all this talent nearby. So very proud and pleased to have them. Dr. Delana Wardlaw is a board certified family medicine physician with Temple University Physicians. Dr. Elana McDonald is a board certified pediatrician, chief medical officer, and owner of 3 Philadelphia-based outpatient practices, Memphis Street Pediatrics, Pizza Hut Pediatrics, and Castor Pediatrics. They're both graduates of Temple University and Penn State Medical School and have been working in Philadelphia and the surrounding areas for over 20 plus years. First of all, they look too young to do that, but
yes.
word on that one. As motivational speakers, medical consultants, and media consultants, they use various platforms to educate and address healthcare disparities. They created the Twin Sister Docs platform to promote health, wellness, and self-advocacy for marginalized communities, including the African American and Latinx populations. Their mission is to provide culturally sensitive and accurate medical information using the 3 T's, trusted messengers that translate to action, leading to transformational outcomes. Both have received numerous awards and accolades for their medical and volunteer work by their peers in the community. 2 most recent earnings include the 2020 Pennsylvania Family Physician of the Year for Dr. Wardlaw and the Pennsylvania Medical Society's Everyday Hero Award for Dr. McDonald. So we welcome you both here. And again, we're just pleased that you've chosen to spend this evening with us.
Welcome, doctors.
For having us.
Okay. And I have the pleasure of introducing Dr. Kito Lord, who happens to be a very close friend of mine for well over 20 years. Dr. Lord is a board certified emergency medicine physician with extensive expertise in clinical operations. He serves as medical director at Regional One Hospital and assistant professor at the University of Tennessee Health Science Center. He completed his undergraduate degree in medical training at Morehouse College and Howard University, respectively. He then went on to complete his residency at Yale University, where he also obtained his MBA. Dr. Lord is currently leading efforts to redesign Regional One's hospital emergency department. He has been instrumental in helping reduce wait times and improving patient quality. He also reshaped the care delivery model at the city's only Level 1 trauma center. Most recently, he has been leading the fight against COVID-19 in the emergency department. In 2020, Dr. Lord was recognized nationally as a top influencer in emergency medicine by the American College of Emergency Medicine and a rising star in the healthcare by Medscape. And you may be wondering how we get someone from Memphis. Well, he's not from Memphis. He's from Philadelphia, where we were born and raised. I want to make sure that I say that he's also a local kid who just went out to do great things and is affecting the world in a positive way.
Great.
Thank you, Dr.
Welcome, Dr. Lord. So let's just jump right into it. We have a series of questions that were submitted over the past few days. Please feel free as we go through. If something jumps out at you, if you're not clear, we have a chat. Periodically, we glance over it. We try our best to address each question that comes up. Let's get into it. So, doctors, first, what is a vaccine? How does it differ from medicine that is delivered in a pill?
Dr. McDonald here, I will take that. So a vaccine is, the main goal of the vaccine is to prevent you from actually having severe consequences or dying from a disease when you come in contact with that disease. Your immune system works off of a memory. It has to actually see a disease process before it can actually develop antibodies, the word we're hearing a lot now, antibodies to fight off that disease process. How does the vaccine work? The vaccine is actually created to give your immune system a blueprint of the virus so that your immune system can create antibodies. So when it comes in contact with that virus, it's all ready to fight it off. We are in a war with coronavirus. So if you think about it, the vaccine is essentially giving you the defense plan for this enemy that you're trying to fight. You have the defense plan, you can develop a defense. When they come for you, you're ready to fight them off. And that's how a vaccine actually works. It is to prevent you from having severe consequences and death when you are exposed to a deadly virus such as COVID-19.
That's a good description.
And I can jump in too. My name is Dr. Lord. So I think when you think about vaccines, I think they've gotten a bad rap over some period of time with a lot of misinformation. When you think about some of the greatest wonders that humanity has created, vaccine is up there, right? When you think about so many of the diseases that used to decrease life expectancy, like whooping cough, smallpox, typhoid, measles, yellow fever, these are all things that vaccines have helped us kind of forget about. And now we're kind of faced with COVID-19, and we're having a good discussion about kind of the safety and efficacy of it. But vaccines, just kind of from an overall standpoint, vaccines are instrumental in expanding our lifespan. And so I just want to frame the debate again.
And I would like to step in and say, we had a recent vaccine development. Does anyone remember H1N1 from back in 2009? Has anyone heard of H1N1 again? No. Why? Because we developed an effective vaccine.
Wow.
It's like out of mind, out of sight, right? Like all of a sudden people forget about how influential these things were.
And so, you just haven't really paid close attention to it. When's the last time you've seen a true case of chickenpox? Now, if you want to date yourself, you will say when you've seen a true case of chickenpox.
I've never seen it.
All right. You must be pretty young. You must be.
I'm very young.
You might be less than 30 if you're saying you've never seen chickenpox.
I had it. It was miserable. I was living.
Dr. Baugh says she's seen it. I see your head, Dr. Baugh.
Hi, Dr. Baugh.
Cool. So,
okay. Follow up, Keisha?
Go ahead. You can go to the next one.
No, you want to go to the next question? Okay. I think in further setting the scene, I think we've talked, how are vaccines created and formulated? Like, how are they even, how does the lab put these together?
So Dr. McDonald here. So in order to create the vaccine, you have to understand how the virus or the disease process actually works. So if you think about the COVID-19 vaccine, in order for Moderna and Pfizer to start quickly working on a vaccine, they needed the genetic makeup of the vaccine. Once China released that genetic makeup, then the pharmaceutical companies quickly went to work on it. And it just wasn't they were starting from scratch. Remember, this is SARS-CoV-2. This is not SARS-CoV-1. That came back in the early 2000s with the MERS and the SARS epidemic. So they started the vaccine process then. Those pandemics ended, so they were kind of shelved. Then when SARS-CoV-2 COVID-19, they quickly, once they learned to genetic make up the virus, then they were able to start to develop the virus from where they were in the early 2000s. So it just didn't start in 2019 and 2020 with the development of a completely new vaccine process.
And also just to jump on that too, it was a collaboration of many different countries all working together, right? Sharing information in a way that we hadn't really done previously. And then to piggyback off that again is that, yes, we were always prepared for some type of virus. That's one of the biggest threats that we've always thought about. And so we've had a lot of partnership across the world in order to be prepared for these type of scenarios. I think that we were at the right place at the right time with, being able to sequence the COVID-19, the SARS-CoV-2, that was essential, right? And we already had mRNA vaccines being worked on previously. So it wasn't like we were starting from scratch, like you were saying. There were a lot of moving parts all at the same time that worked together well.
Yes, and I would like to say that I think that the term Operation Warp Speed gave a lot of people some hesitancy. And what that simply meant with what Dr. Lord and Dr. McDonald was saying, it allowed for many agencies, government, private agencies, international agencies, to come together to be able to do many steps at one time instead of doing them consecutively, being able to do the steps at one time congruently. So not as much time had to be taken to further develop the vaccine. However, being sure that safety protocols were not abandoned.
So let's pick up on that strand of thought, right? So everyone is concerned about the accelerated process that the approval went through. Like, how long typically had it been taken? And why was it the case that they were able to accelerate it in this instance?
So Dr. Wardlaw here, again, able to accelerate it because the technology for the messenger RNA vaccines, it was not new. It didn't start in 2020. Again, this research had been being developed for well over 10, 15 years. So that is what allowed them to be able to get steps in a faster pace. Number two, again, several partners came together to be able to do steps in a simultaneous fashion. So that allowed for time to be able to be used more wisely. And also, we just have to I lost my train of thought there. Give me a second. Give me a second.
Well, also,
Go ahead, Dr. Lord. Then
thank you. I mean, also too, we also were able to find out that the spike protein, which is this little area that we were able to figure out that this is part of the infectious particle of SARS-CoV-2, or we usually refer to it as a COVID-19 disease, right? So we were able to find and pinpoint an exact place of where we could actually target, which is huge. That takes years and years. And so the other thing too is, as you were saying, is that it was a collaboration. I mean, this is the biggest pandemic we have seen in 100 years, right? And I think that global sense of multiple governments across the world partnering together to find a solution cannot be understated. And that's part of the reason why it was such a huge precedence. Also, you had, pharmaceutical companies stopping what they're doing on the other pharmaceutical drugs and everything else and focusing their attention on this. So this became a race to kind of cure humanity. And when you think about the amount of money that went in there to help fund these projects, it was immense. You got government funding, you got private funding, you've got partnerships from across the world. So the global perspective is really important to think of when you're considering the fast-paced nature of this vaccine.
I remember my thought.
Why you remember your thought?
I remember my thought. Also, we're in 2020 now. Time is on. Time has allowed us to have advancements in tech and vaccine technology. So what it took us a longer time to do 20 years ago, we have advanced technology now that also diminished some of the time that was required to make the vaccine as well.
Right.
So many drug approvals require what I've heard are 2 well-controlled clinical studies. Were each of these vaccines subject to well-controlled studies, at least one, and were either of them subject to 2 studies?
So the gold standard when you're doing studies is a double-blinded placebo-controlled study. And basically what that is that you're giving the actual vaccine to a person to see if their immune system responds. And then then there's another group who gets a placebo, and the placebo is really, some people use the word sugar pill or things like that, but it's really nothing that they're receiving. When we say double blinded, the people who are administering it have no idea what it is. The people who are receiving it have no idea what it is. So we can really get a true, accurate data of how the body is responding. So you want to see how persons with the vaccine, how the immune system responded, and then you want to see how persons without the vaccine immune system actually responded.
And I will say that also with so Pfizer and Moderna, the other thing that allowed, as these questions are coming, that allowed for the vaccine process to go a little quicker is that these trials were large. One of the companies had over 40,000 participants. The other company had over 30,000 participants. So that allowed us to get data at a quicker rate as well. And so that is another reason why we were able to get the vaccine at a quicker rate as well. So yes, the participants participated in the study, and the company who is developing the vaccine, they do not determine the results of the study. That is determined by an independent agency who monitors for the side effects, who monitors for the effects of the vaccine to make sure that it does work. Then if that independent company sees that, okay, well, no, we're getting more side effects than we anticipated, or that, well, no, it's not actually going to protect against severe complications of coronavirus, then that information isn't even presented to the FDA. It is pulled, it is shelved. But if the data is promising, then the independent contractor will recommend that the manufacturer recommends it to the FDA. Then the FDA will review all the safety and policies and procedures that are mandatory to go through. And then the FDA recommends it to the ACIP, who is a panel to review the data and make sure everything was reviewed. So, and again, it's not the company itself that just make the determination if the vaccine is safe or not. It goes through these safety policies and procedures to make sure that it works and that it is safe.
Okay, so that makes sure that it's independent from the people who are going to make money from the vaccine. That's good to know. Go ahead, Dr. Lord. I'm sorry.
And also, just to kind of give the next step, is that they're also reviewing all the adverse events, whether or not they're related or unrelated. Everything that's reported is reviewed, and especially any type of severe complications. And so, ongoing with the millions of people who've been vaccinated already, the CDC and FDA, they're reviewing these cases of any adverse outcomes whatsoever. And so there's still a level of scrutiny even after these studies have been done. And again, you're right, these are two good studies with good results, and really, honestly, to be quite frank, they're really impressive in terms of their ability to protect against COVID-19, and with 95% reduction. And that's amazing. When you think about the flu vaccine and other things, you're thinking about 50% or so, a lot less. And so these were actually really impressive. And I could go on and on about how there was recently a study that just came out, I believe, like this week or last week, about from Israel, looking at all the reduction in the transmission of COVID-19. And again, just more data points of the safety and also of the efficacy of the vaccines.
Great.
All right, so moving to our next question. So we've heard that the vaccine, the COVID-19 vaccination, differs from the flu shot. The understanding is that the flu shot has a dead strand of the virus. What's the difference between this shot and the flu shot? Because oftentimes I'm sure people compare the two, and the makeup of it. How does it differ?
Okay, so the flu vaccine is what we call an inactivated vaccine or dead vaccine, where there's an inactivated form of a virus that is introduced into the body to not cause any illness or any severe side effects or complications, but it allows the body to be able to recognize a foreigner so that it can develop a defense, as Dr. McDonald talked about earlier. So it can develop antibodies so that when you are exposed to the flu virus, your body is ready to fight. COVID vaccines use the messenger RNA technology, where the messenger RNA is encapsulated in this lipid molecule, which is injected into the body, and it actually gives your cells instructions to make the spike protein that is of the coronavirus without the coronavirus being in it. So once your body recognizes the spike protein that the cells have been given instructions to make, it makes antibodies to it. The antibodies then allow you to be able to fight off the real coronavirus spike protein in the event that it comes into contact with it. But there is no virus with an inactivated form of the virus in the Pfizer and the Moderna vaccines.
So I've heard persons who've gotten the vaccination say, especially after the second time, they experience symptoms. Is that because it's doing exactly what you just explained? Is responding?
So you can get side effects from the vaccine, and you can get it after the first dose, and you can get it after the second dose. Some people don't have any side effects at all. The side effects will vary depending upon each person, but side effects, headaches, lightheadedness, injection site soreness, fevers, muscle aches. So these are common side effects that we see, and those are signs that the body is starting to mount an immune response, starting to develop its response. Yes, but it can happen after either dose, or it might not happen at all.
And usually they're limited to 48 hours, are usually the limit of the side effects of that may have. The vaccine's working, right? And I think that's what's going on, is your body is being stimulated, and I think that's a sign that it's actually working.
And I received the Moderna vaccine. I got the first Moderna vaccine, went on off to work. A couple of hours in, I realized my arm was really sore, but I was still able to do all my usual activities. And that was it. Yeah. After the second dose, I went to work, arm got sore, not as sore, but day one, I started to feel a little bit more tired than I normally would be. And then by day two, I had some mild headache and some body aches. By day three, everything was gone.
Yeah. Okay. Yeah. And I think it's really important to frame all these conversations in terms of what the alternative is, right? So COVID-19, is a deadly disease. And I think when we talk about the deadliness of it too, let's also take a step back. Even if it doesn't kill you, there's sequelae there that can last a long time. There are blood clots, chronic headache, chronic fatigue syndromes. There's a lot of complications with COVID-19. And so when we're weighing these risks and benefits, we have to make sure we're talking about the side effects of the COVID vaccine for 48 hours versus the long-term sequelae of a COVID-19 infection. And I had a colleague who actually got infected, and they were out for a month. Right? I mean, they were out of work for a month, like literally a month. And when you think about, the lost wages, being isolated from your family members for prolonged periods of time, there's a lot of other things when you're weighing the pros and cons of taking the vaccine.
And to piggyback on Dr. Lord, for any vaccine or any medication that we're giving you, there's always a potential for side effects. If you look at any commercial that comes on TV, you're going to see all those side effects. They may say it quickly, they say it across the bottom really quickly, right. But it is there. But you have to look at, again, as Dr. Lord said, the benefit versus the risk, right? The benefit must outweigh the risk. If the risk is outweighing the benefit, we shouldn't be having a discussion with you, right? We shouldn't be that's going to cause you severe consequences. But are we willing to accept the minor symptoms that we have after the vaccine, or are we willing to risk what we've been seeing people suffer from when they have the actual disease?
And 500,000 people are dead. 500,000 people are dead in the United States alone. We can't lose sight of that. Yeah.
Right.
So we have to the next question.
Enid, I'm going to address this. Enid, we have one question that's been sitting in the chat for a minute. Someone said, I'm scheduled to receive the vaccine on Monday. I've heard that you should get tested first. Is this true?
No, not necessary at all.
Okay.
Oh, ma'am.
Nope.
You don't have to get tested, and please don't take any prophylactic Tylenol or Motrin. Don't take medicine just in case you're going to get side effects. Only take Tylenol or Motrin if you get side effects after you've had the vaccine. We really don't want you taking it before, just in case.
Yeah.
Okay. That's good information.
They said thank you. Okay.
They said thank you.
Yeah. Great. So we've talked all about a vaccine, what a vaccine is. We've talked a bit about what the two approved vaccines are. So let's get into the nitty-gritty. What's the difference between the two? Like, does it matter which of the two should be given? I think one of them may be even going down to one injection. So could you talk about compare the two and the differences?
There's not much of a difference. It's just two different drug companies. And I think part of it is that because the studies were framed in a certain way, we like to follow that. So if they give it 2 doses, that's what we like to follow until we get new evidence to suggest that 1 dose is okay. So if for right now, if you're getting Pfizer, you should stay with Pfizer. If you're getting Moderna, you get Moderna. The efficacy of both of these are still excellent, amazing. And just to kind of give you guys a bigger framework is that there are a lot of different vaccines that aren't in the US right now. And so there's a lot of vaccines that aren't as successful in terms of preventing COVID-19. The Moderna and Pfizer are two excellent vaccines. And so I got the Pfizer myself, and I believe my mom and my dad got the Moderna. And so it just varies, but I'm just, happy that they all got that.
I received the Pfizer.
I'm sorry.
I received the Pfizer, and I recommend that you get the vaccine that's available to you. As Dr. Lord said, they are both comparable vaccines. They both use the same technology. So get the vaccine that is available to you. They're both highly effective, and please consider. Yes.
So
You took the words out of my mouth, Dr. Wardlaw.
For each of those options, is there extensive data in the Black population in the study? Like, has it been studied in our population?
That's a great question, because we always ask for African-American volunteers to join the trials, and we don't show up in great numbers. And if we don't show up in great numbers, it's hard for us to answer how effective it's going to be in African-Americans. However, the good news is with the Moderna and the Pfizer vaccine, they were able to get about 10% of their participants were African-American. So, that we think that was a good showing. So yes, we recommend African-Americans absolutely get the vaccine.
And we think that was a good showing because 10%, we represent about 14% of the population. So that's why we say we think that was a good show.
Indeed. Yeah, that's right. It was
So
there. Oh, I'm sorry, Keisha.
Go ahead. No, I'm sorry. We have a delay. I'm sorry, Enid. I didn't cut you off.
Just one more question in that vein. Was there mortality data that was collected? Do they know the profile for each of the vaccines from a mortality perspective?
There is they always collect mortality data with the vaccine. If there's ever an adverse event, then the investigators will look into that event and see, was it just a coincidence or was it directly associated with the vaccine? And that's what has to be figured out. So, and as people ask about whether or not it's safe, the vaccine was proven to be safe, number one, before it can be rolled out. Remember, it has to be safe and effective before it can be rolled out to the entire population. But if you also look at the numbers of people who've been vaccinated thus far, over 60 million people have been vaccinated as we speak. We're not hearing hundreds of thousands of deaths. We're not hearing those. So the likelihood of death is extremely low. Now, as a physician, a pediatrician, I give vaccines. I've been giving vaccines in my office for 20 years. What I tell every patient is, can I sit here and guarantee you with 100% certainty you will not react to any vaccine? I cannot. Just like I can't guarantee you will not react to Tylenol, Motrin, amoxicillin, Bactrim, anything that you take. However, the data has shown that it is unlikely to happen. It's unlikely to happen.
And I can piggyback off that too. I think you made a great point. There's always an inherent risk. With both of these studies, there were no deaths in terms of in the placebo, in the treatment group in both of these, so Moderna and as well as Pfizer. And again, if you were to take a look at all the mortalities or reported things, none of them have been linked directly to the vaccine. There are 8,000 or so people who die every day in the United States, right? And so, there are going to be people, especially elderly people, who get the vaccine first, who may pass away. So it's really important to look at the data. It's really important to listen to the physicians, people you trust in your communities, to kind of interpret this data. As of right now, there have been no deaths related to this the COVID-19 vaccine. There have been a lot of deaths related to COVID-19. And I think, the 500,000 people, we reached that mark. I think there was a study that just came out that showed that one of the leading causes of death is COVID-19, right? And I think, we need to keep that in perspective about how dangerous this disease is and how much it affects or impacts communities of color who are at higher risk. And I think this is one of the solutions that we have, the only solution that we have in the near interim regarding treating patients who are at risk for COVID-19. So.
All right, so let's kind of get a little more candid.
Okay.
We spoke to how quickly this vaccine was created, and our community, more specifically African Americans, have not had the best reputation as it relates to healthcare, and still to this day, we don't have the best experiences when it comes to healthcare and trust and transparency. Speak to us, like tell us why, and as real as we can put it, why this is something that will benefit us.
Okay.
So number one, the mistrust has absolutely been earned. So we have to acknowledge that, you know, all the events of history, you know, even current events of today, the mistrust has certainly been misearned. People need to acknowledge that, accept it, apologize for it. However, we don't want that mistrust to prevent you from making a decision or allow you to make a decision that's going to prevent you from getting a vaccine that could potentially save your life. We know that African Americans are dying at 3 times the rate of Caucasians. Now, we've tried while the mask wearing, the social distancing, the hand washing has worked to some degree, we still have 500,000 people that have died in the course of 12 months. So that is simply not enough. We know vaccines are tried and true. This is the next best step. So I tell people, yes, we don't want you to forget what has happened in history. We absolutely don't want you to forget and act like it didn't happen. We don't want people to come to you and just say, hey, listen, just take the vaccine, because we know that mistrust is there. But that's why we come to these talks. We're on, you know, the radio, we're on TV shows or local media shows, because we know that people who look like us are more likely to listen to us. And we want to get that message out. But at the end of the day, what we've done so far is simply not working, and we are dying. So yes, we know Tuskegee happened. We know about the Holmesburg experiments. We know about the Henrietta Lacks cells. We know about the implicit bias, not being treated accordingly when you go to the hospital to be taken care of because of, you know, misconceptions of you. However, this vaccine is here to benefit us all. So I ask people to please consider that.
And again, so the things that make African Americans more susceptible to complications of COVID, lack of access to quality health care, you know, us living in multi-generational housing, you know, us living in densely populated areas, us working and, you know, a large volume of us working in the workforce where many of us don't have the access to work virtually or work from home, or we're essential workers. But those things are not going to change overnight. Right now, we're dealing with a pandemic that is affecting us now, and that is killing us at disproportionate rates. We have to change that narrative. So that is why we would like everybody to receive accurate information so they can make an accurate, informed decision. They can make an informed decision based on accurate information so they can do what's right for themselves, their family members, their community. So we just ask people to consider it, get accurate information, because again, we recognize we still have to change all those things. We have to address all those things, but that's not going to happen overnight. We need policies and procedures put in place. We need to make sure that we're addressing systemic racism. We need to make sure that we are addressing, because racism is a healthcare threat as well. We know that people have suffered from severe consequences from racism in the healthcare system. However, we can't allow that to prevent us from addressing an issue that is killing us now and affecting us now. And as Dr. Lord said earlier in the conversation, and for those who are lucky enough to survive, there are the long-term consequences that we have to deal with as well. So please, we want everybody to be educated so they can consider it, because we're in a pandemic and it is killing people very quickly.
Yeah, and I can just piggyback on that too. I mean, it's you know, when you think about the Tuskegee experiment and those type of scenarios, you know, the question is like, what side of the experiment are you on, right? And in the Tuskegee experiment, they were withholding medication, right? And here, you know, we have a medication that is effective, it's been proven, and unfortunately, certain areas and certain populations are not getting it at the same rate that they should be getting it. So, you know, that's the reason why we're on this circuit. That's the reason why I'm here today. You know, I'm from Philadelphia. You know, my mom lives over in Wyncote. You know, I go back. I mean, it's so important for me to have this talk with people to let you know that I took the vaccine myself, right? My colleagues, everybody on this, you know, we took the vaccine. And I thought it was a privilege, first of all, to be able to be one of the first individuals to get the vaccine, being a healthcare worker. And I've told my mom to get the vaccine. She, you know, she's gotten the vaccine. I told my father to get the vaccine. So I'm speaking from experience as a Black male with family members who are at high risk categories, that I'm telling you with all, you know, all the passion I could possibly give you guys, that you guys need to get the vaccine as quickly as you possibly can. is extremely important in terms of the risk. I mean, I've seen people die, right, and struggle for breath, and I've seen young people in their 30s, intubated, on a ventilator, family members not understanding what's going on. They can't even see their family because the hospitals aren't allowing visitation. And so I think, while you're safe and you're able to take the vaccine, do it. There are 500,000 people who passed away who probably would have given anything to get that vaccine, right? And so you're sitting right now in a place of privilege of being able to make that informed decision, and don't take that decision lightly. So again, I think we're here to tell you that we feel as though it's safe, effective, and it's something that you guys should do as soon as you get the opportunity.
Thank you for that. So answer this question: why 2 doses? Why can't we just get 1 shot and bam, it's done?
So again, as a pediatrician here, I'm going to speak. 2-dose vaccines is not new. So several childhood vaccines are 3 and 4 doses, and then you get boosters, later on. I implore all you guys to go look at your child's vaccination record. You'll see most of the vaccines are 2 and 3. Very rarely is there 1 vaccine that you get and you're 1 and done. So the purpose of the 2 doses is, 1, you have to, again, your immune system has never seen this disease in most cases of people. And so we have to prime the immune system, and then it responds to a certain degree, but then you come in and you boost it, and then you get the best response after that booster dose. So the studies show that for the 2 vaccines that are out now, you needed that booster dose to get to the 95% effectiveness.
So I'm hearing you say it's important that you get both.
Absolutely, because if you get 1, then you're only going to get, 40, 50% protection. But to get to 95%, you need both doses.
Okay.
All right. I think you guys answered already why the 2nd dose kind of makes us feel a little sick. There's been conversation about a new, there's been a lot of conversation. I think a lot of people have some hesitation because we hear people are being given vaccines, and they're still testing, there's still studies being done on it. Do you anticipate any change? And this is just your professional opinion. Do you anticipate any change on the dosage in the future, or is this kind of like, we'll see as we go?
So with vaccines, there's always a continual monitoring system. So even though the vaccines, they're administering the vaccines now, they're still monitoring for side effects. They're still monitoring for the efficacy to make sure that it is still working. We've been hearing about variants, right? So they still have to make sure that the vaccine is still effective against the variants, which to date, the vaccines have still been shown to be effective. So yes, they're still doing studies, and that will continue. We need the studies to continue to be ongoing, so that we can be able to pivot if we need to. Now, for example, the flu vaccine, it's a seasonal vaccine. We have to get that every year because the flu virus mutates every year. So that possibly could be the case for COVID. We don't know that right now, but that is why the studies have to be ongoing. So no, it is not in our best interest to just stop the studies. We need to do to continue the studies so that we can make sure that the vaccines are still working, still effective, and still doing what it needs to do.
Hey, Keisha, I understand Dr. Baugh has a question. If you want to put it in the chat, you could type it up and we can read it to the latest. Nothing too tough. Go ahead, Keisha. My apologies.
Very good. So how long after you get your 2nd shot are you fully, and we understand it's not 100%, but are you considered fully protected?
That's approximately about 2 weeks after the 2nd shot.
Okay. Okay.
And
go ahead. I'm sorry.
Keisha, can I just also want to say that for everyone who receives a shot, there is a vaccine adverse reaction reporting system. So if you have side effects, you're encouraged to report those side effects again, so that we are aware as scientists in the medical community exactly what is going on with these vaccines as we continue to move forward.
Do they give you paperwork and tell you to do that after you get your shot? Or
absolutely, you should receive that paperwork.
Okay.
And is it important that we still mask? And this is kind of rhetorical, but is it important we still wear masks and we still social distance even after, no house parties and all that, after we get our vaccine? Because, some of us want to, but, it's important. Sometimes we hear it out loud.
Yes, it's still important to wear a mask. I work in the ER every day, and I still wear a mask. I'm vaccinated. I think there's a few reasons. Number one is that they were looking at severe COVID disease, and a lot of times when you talk about asymptomatic carriers, we still don't have a great idea about what that rate of transmission is. And we're talking about 95%, not 100%, guys. And so there's a big difference. And so that there's a 5% chance there. And so when you start to expose yourself and you increase your risk of getting the disease. And then lastly, there's still variants out there that we're learning more and more about. And there is protection with these vaccines. But again, we still have a lot more information to learn about these variants and these mutations that are coming out. And so, to protect yourself from them as well, it's still important to do that. So those are the big three areas I have.
And can I just talk to variants for a second? So variants are allowed to develop when the virus can continue to replicate. And in order to do that, it has to be able to have a live host to continue to transmit to. So that's why it's important that we encourage everybody to consider getting the vaccine, because we need to stop the live host that the virus can continue to transmit to. So that's another reason why we encourage everybody to get the vaccine when it's available to them.
Someone in our chat asked, if you take Tylenol after the shot, does it affect the vaccine? I'm curious why you said not to before too. Is it like lessen the effectiveness, or I'm not like jumping over their question, but it's two-part.
No, it's been recommended not to do that because you don't want to blunt you don't want to decrease the effectiveness of the immune response.
Okay.
So after you get the vaccine, do not take Tylenol?
Before you get the vaccine. Before you get the vaccine.
You can take
So once
it.
you start to have symptoms, we recognize that the body is starting to work. It's starting to mount its defense. So it's okay to take it then, but we don't want you taking it what we call prophylactically, just in case.
Okay.
So there's a few other questions in the chat that I'll read. The first is from the Murray family. It says, when you are traditionally ambivalent about vaccinations due to the use of abortive fetal tissue, do you know if there will be an option to request a vaccine that meets your needs morally, ethically?
So I will take that question. So, when we talk about vaccine ingredients, the question about fetal tissues have come up. And there have been some vaccines where there were some fetal tissue used, the chickenpox, rubella, the hepatitis A, rabies vaccine. So, but you will not be able to get a different vaccine. So one is the COVID vaccine was not developed from that. But two, if a vaccine is generally developed like that, you typically have to decide if you ethically want to get that vaccine, if it's for you or not. But you usually cannot ask for a completely different type of vaccine with certain ingredients held.
And most places, when you go to get a vaccine, most places have either or. Most places don't have both of them available on site.
Okay. You want to do the second question, Brent?
Sure. Tamika Anglin, I hope I'm not missing your last name, but I apologize. How do the antibodies developed from the vaccine differ from the antibodies developed due to having COVID?
That is a great question.
It is.
So, a great question. So remember, we don't want you to get the disease to develop the antibodies, because we really don't know how you're going to respond to the disease. Some people may be asymptomatic, some people may have mild symptoms, some people may die. So you don't know, it's like a gamble. And so, and studies have shown that when you get you develop antibodies from a vaccine, that's what we call a more robust response of the immune system. So twofold, we don't want you to get the disease because we don't know what your outcome is going to be. But two, after you get the vaccine itself, that boosts your immune system more than what we call natural immunity from actually having the disease itself.
Thank you. Dr. Ball asks, who knows when the first vaccine was given?
I don't know
Yeah.
the answer
I
to
don't know
that.
that, Dr. Ball.
I don't know the answer to that one
That's
either.
a Jeopardy question, Dr. Ball.
So, and I think part of it too is like they're clinical studies too, and so the question is like, who's the first person to get the vaccination from the clinical studies? I don't know. I'm not sure.
So, Dr. Ball, enlighten us.
The answer in there was in 1796
Okay.
when the smallpox vaccine was given.
Wow.
And the
Wow.
other
Thank you, Dr. Ball.
that I put in the chat was that today Johnson & Johnson announced that it has a 1-dose vaccine that they're putting out.
Mhm.
They're just waiting for approval.
Yes. Once they get
So it's not available yet.
But it's not available. They're just
And if
waiting.
I could just piggyback on what Dr. Ball mentioned in Johnson & Johnson, the 1-dose vaccine is a game changer. Because we've seen issues with the vaccine being distributed, so, and we want people, you get the first dose, the logistics of getting back for the second dose. So, that one vaccine will absolutely be a game changer. So, and it's just another vaccine to help us, because remember, we're trying to vaccinate an entire nation. We haven't done this since polio.
Yeah.
So this is a huge undertaking. How do you eat a 2-ton elephant piece by piece? So we need layers, multiple vaccines that are safe and effective, and multiple avenues to get the vaccine out. I know I went off course there. I apologize.
No, absolutely.
There's one more question.
One more question from Deanna Allen. If you have had COVID prior, is the vaccine beneficial to you?
Yes. The recommendation that is if you've had COVID that you should get the vaccine. We don't know how long the natural antibodies last. So we do recommend that you get the COVID vaccine.
Cool.
Hey, thank you.
Okay, great.
So we broke down dosing. We talked about the vaccine in itself. Let's talk about availability and accessibility. How can we navigate how to get the vaccine? Do you know ways people have been able to find places to get vaccines? I know in our communities in particular, it's been a little challenge. What's your insight as it relates to that?
One, I would recommend that you sign up at your health department. So unfortunately, the physician's offices haven't been allotted vaccinations. Typically you used to go to your doctor's office and get vaccinated. Our patients rely on us to do that, but that has been taken out of our hand at this time. So the recommendation that you sign up on your county's health department's website. Two, you can sign up there are some vaccination other clinics that are available that may be going on, and you go and sign up at those websites. Also recommended that if you are a part of if your doctor's office is a part of a healthcare system, many of the healthcare systems are contacting their patients now that they have their staff evaluated and the patients in the hospitals, vaccinated, and the patients in the hospitals vaccinated. Now they're moving on to vaccinate their community patients at the community offices, since the physicians don't have them in the offices. So those are the ways that it's recommended to get the vaccine. It's a challenge, and hopefully things will get easier. If Dr. McDonald and Dr. Lord have anything else to add, please do. But it's a challenge, unfortunately.
It's a challenge. It's a big distribution of a lot of vaccines, and there's a high demand and low supply. And then the storage requirements for these drugs, these vaccines are also high, right? So they have to be kept at certain low temperatures. When we talk about healthcare disparities, using the internet, obviously, and having to sign up online kind of puts some people at disadvantage. So I do encourage, everybody on this panel, if you know people who aren't internet savvy, who do meet the criteria, to help them navigate how to sign up or help them call their healthcare providers to get direction as to how to do it. But a lot of people don't have the internet, and a lot of elderly people aren't good at signing up on forms. And we need to keep that in mind when we think about our elderly population here.
Why is I'm sorry. Go ahead, Dr.
One
Ward.
other thing, you can sign up at the local pharmacies. There are local pharmacies that are administering the vaccine as well. Again, that's a digital divide access issue as well. You have to go to the website, and you can Google what pharmacies in your area are dispensing the COVID vaccine and sign up that way as well.
Why is it that you can't cross county, right? So some of us, like in Montgomery County, are kind of upset that we see Black Doctors Consortium like kicking butt in Philly, but technically we're not supposed to go to Philly, right, to get our vaccine. You're saying stay where you are and find out. But communities like ours, who, as a community, we're finding the information, but we may not be getting those resources the way we feel we should? Why is it that we can't go over to Philly, or Philly, you know, if it was vice versa, can't come over here? Why can't you cross county?
Great question, but usually counties are allotted the vaccines from the government. So Philadelphia County gets its vaccines, Montgomery County gets its vaccines, Chester County gets their vaccines. So each county get their vaccines for their residents. So that's really how it works. And unfortunately, the fact that people are looking across counties and do, you know, go wherever they can go is showing us that the access is just not there. So we need to get the vaccines available to everyone so that people don't feel like that they don't have the opportunity to get the vaccine. So we have to deal with this access problem to make sure, one, you know, hopefully the vaccines start to be distributed at a much quicker rate, and they will get to where they need to be so that people can get the vaccines at a much quicker fashion.
More questions from the chat. One from Linda Jones. What's the difference in efficacy between all vaccines? Moderna, Pfizer, and of course the Johnson & Johnson that's on the way.
Yeah, I think so. The efficacy was pretty similar, and I think there was like 95 versus 94% reduction in COVID-19 disease, and so I think so. Both of them are interchangeably. I think the Johnson & Johnson is less, on the top of my head, I think it was a little bit less than those two combined at this current time. But that's not right now, the Johnson & Johnson is not in play right now. So between the two, there's literally no difference between the two.
Agreed. So get the one that's available to you.
Please.
I think there's one more there's a couple more in the chat, Brent.
Mr. Lewis?
Yeah. So there's, because the last one was a bit of a statement, which I'll read anyway. The statement says we should reach out to elderly and help register them for the vaccine. I think it's a great idea. Elderly and the underserved and underprivileged, that folks like Kito was saying, Dr. Lord, excuse me, that doesn't have access. Mr. Lewis says, is there an age recommendation for the vaccine?
Yes. So the vaccine has been approved, remember, so for Pfizer for 16 and above, Moderna for 18 and above, but the vaccine is being rolled out based on priority. So of course, essential healthcare workers, frontline workers, elderly people over 75, people under 75 with certain chronic conditions. So while the vaccine 16 to 18, anyone 16 or 18 can get the vaccine, it just hasn't been rolled out to those younger ages just yet, unless you have some kind of chronic medical condition that puts you in the higher risk group.
That was a perfect segue to the next question, which was, what will the vaccine look like for children and teenagers? Obviously, we don't have any concrete, answers, but what do you project it will look like in the coming future as it relates to our children in particular?
So it's hard to project, but because we say children are not little adults. However, that's why we have to do the studies in children. But it's a good chance that it's probably going to be a 2-dose vaccine in the children as it is in adults also. But before it can even be rolled out to 2, 3, 4-year-olds, we need to get that data on them.
Okay. And are there any animal studies that show how the vaccine acts in pregnant women and infants that you guys know of?
So originally, when you do a trial, you really don't want to bring healthy. You usually do it on a healthy population. You're not necessarily going to bring in pregnant women. However, there were some women who did get pregnant during the trials. So they are looking at that data, and as they continue to look at that data, they'll have more data available. However, the ACOG, which is the American Academy of Obstetrics and Gynecology, who take care of pregnant women, their recommendation is have a discussion with your doctor. Again, the risk of the vaccine versus the risk of getting COVID when you're pregnant is what has to be discussed, and then make the determination. But ACOG recommended that, yes, if a pregnant woman wants to get the vaccine, absolutely they can get the vaccine.
Okay.
And the reason that is because the consequences on pregnancy is severe with COVID. So consequences on pregnancy, preterm labor, preterm delivery, premature infants being born, it has a significant set of complications in pregnant women. So again, risk versus benefits.
Yeah, and there've been and pregnant women have been vaccinated. It just we haven't studied it as much as and we're studying it now, but we haven't studied it as much going forward. But I mean, I know personally pregnant women who've been vaccinated in my institution, and so it shouldn't withhold the vaccine because you're pregnant.
I have another question with that. How long do vaccine antibodies last?
That's still a
study.
It's still a study.
Yeah. So again, with COVID, everything is based on what we know today, and and again, somebody asked earlier why we're still doing tests and things like that for this very reason, so that we can know what's going on. We don't know all the answers right now.
Right. We wish we did. Okay. Well, do you guys have any? I mean, we presented the questions we had, but from your experience, from your professional perspectives, any additional insight we didn't cover that could be a benefit, could help persons who may be like, I want to get it, but I'm nervous, kind of on the fence. How would you speak to that person?
I would just like to say, listen, just please make sure that you make your decision based on accurate information. With that, I would like to dispel a couple myths. One, that the COVID vaccine is not injected COVID into your body. A lot of people have many people, I'm not gonna say a lot, but many people have some hesitancy because of the Tuskegee experiment, where many people think that the participants in the Tuskegee experiment they were injected with syphilis, and that wasn't the case. The problem with the Tuskegee experiment is that these men did not receive the treatment that was an effective treatment that was available for syphilis. But there's a lot of hesitancy when I talk to my patients and they say, why would I take that vaccine when they gave us syphilis? And that's just not the case. So please make sure you have accurate information when you're making a decision. So we're not injecting COVID when the vaccine is administered. It's not altering your DNA at all. It's not affecting your fertility at all, and it does not contain any tracking devices.
Yeah. And I think also we're fighting like two battles here. We're fighting COVID-19 and also misinformation, right? And back in the day when the loud guy on the street corner telling you all these conspiracy theories, you just walk by him, and now he has a YouTube channel with 100,000 subscribers and has a bigger platform than any of us, right? And so you have to be very, very careful about who you're listening to, and check their credentials, see if they've actually walking the walk and talking the talk, and make sure that you're listening to the right people. So a lot of misinformation about the COVID-19 vaccine is even politicized in terms of, don't wear a face mask, wear a face mask. And it's been difficult for the average person to figure out what should I do. So I'm going to be very clear that the vaccine is safe and effective, right? Number one. Number two is that masks work, okay? And I'm going to tell you, I am around COVID patients every single day. And I wear a mask during my entire shift. And I just want to emphasize that it has protected me from contracting the disease. So face masks are really important. And also social distances is also important as well. And those three things keep you safe. The other thing I want to say is, like, if you're on the fence, the question is, what are you waiting for, right? I don't see COVID-19 going away anytime soon, unfortunately. And I understand that some people are waiting like, oh, look, let's go away. I think people said they would just go away and disappear. It's not, unfortunately, unless we're intentional about getting vaccinated. And so if you're waiting for something, figure out what you're waiting for or what that trigger is, because I'm not sure if I don't see, this getting better unless all of us are vaccinated going forward.
And in my final thought is what Dr. Lord said, what is the alternative to not getting the vaccine? And we've seen what the alternative can be. But also look at what we've lost over the last year. The ability to send our kids to school, back to college campuses, going to weddings, restaurants, going to our kids' sporting events, professional sporting events, going to see grandma and grandpa. If we want to try to return to some sense of normalcy, we need to really consider the vaccine, because that's what's really going to give us the opportunity to do that again.
Dr. McDonald, that's a great point. Someone had put a question similar to what you just stated, which was, how do you feel about school districts opening even with hybrid models and staff are not all yet vaccinated?
Well, I think that one, if you can get the staff vaccinated, you absolutely want to make sure that they're vaccinated. Again, we have another layer to help protect them. So I suggest that as many staff members get vaccinated as possible, and not just teachers, your kitchen staff, the people who are cleaning the school, everyone who is coming in contact with the children in the school should be vaccinated.
Okay.
The questions are starting to flood in.
Yeah, they are.
So they're really good questions
They
too.
are.
So William asks, do you have a sense for when those in the next category of people without comorbidities, and I'm hoping I'm saying that word correctly, will be eligible for vaccination?
No
Unfortunately,
idea.
we don't have that information.
Okay. Cheryl Hersey.
I just read that one. Mhm.
I'm sorry.
Right. We covered that one. You can go to Ms.
Great.
Green.
And then Karen Green asks, how much do we need for herd immunity?
About 80 to 85% of the population. That's a huge amount.
We got a long way to go.
Where are we now? What percentage are?
Everyone should be getting vaccinated.
Yeah, so about 85%. So about 85%, as you were saying, you know, about 85%, and you know, we're a long way from that. That means that everybody around you is pretty much vaccinated except for a few people, and so we're not there yet, unfortunately, and even we're close to that.
Do we know where we are percentage-wise as a nation?
Last time I looked, I believe we were still less than 20%. We
had 23 million like infected. I mean, it keeps changing day to day, so that's part of the problem. If you list a week, then you're going to miss the millions of vaccinations. But you know, we're still less than 23%. I mean, 20% definitely with respect to the number of people who've been infected and the number of people who have been vaccinated.
Kimberly asks, is an N95 mask really better than the disposable?
Absolutely. Is it better than a regular disposable mask?
Yes.
Hold on, let me just step back. Let me clarify. A disposable mask. She means like a mask. The N95 is the most effective mask that we have. Okay. I'll just leave it at that. It's the most effective mask that we have.
Yes.
More effective than 2 masks? Because they don't
Yes.
wear 2 masks too. Okay.
Yes, it is the most effective mask that we have.
Okay.
What we're using for Ebola and everything else like that too. So this is, as a healthcare providers, this is what we use when we're in high risk situations.
We have a follow-up question to the herd immunity question from Alex. What are the projections for the herd immunity? What's the timeline?
If we don't get these vaccines out in a quicker rate, we won't probably beat to herd immunity into 2021, 2022.
Yeah.
And that's a hard question to answer because again, you know, it all depends on what the data looks like, you know, how many people are getting vaccinated. So it's a hard question to
and the other thing too is also with respect to, you know, there are other mutations going on too. So that's going to complicate things. So the mutation is also going to play a role. And the second thing is that it's a global pandemic, not just United States pandemic. And so there are a lot of places that that could come and bring more infection into the United States or vice versa and create more mutations going forward. So I would not plan on herd immunity as a strategy. I think it might be too long and you may actually contract the disease prior to reaching any type of level of herd immunity.
The Murray family asks, is that 85% naturally through exposure or through vaccination?
It's going to be through a mix.
Through vaccination.
Yeah.
We do not want 85% of the population to get COVID because we've seen the catastrophic effects that it can have. So we want people to get the herd immunity from the vaccine, not from the disease process.
Yes, absolutely. We do not want, you know, all these 85% of the population to be infected with COVID-19. It would be disastrous to our healthcare system. It would just overwhelm us, first of all. A lot of us will lose, you know, more family members and friends, unfortunately. So it's really scary. And I think the natural immunity theory is completely debunked and is scary and would cause catastrophic levels of healthcare crises. So that's not a good idea.
Well, I think those are all the questions we have for this evening. We really appreciate, well, first of all, we just extend our thank you as a community for the service you guys have done over the years, but more in particular during this pandemic. I can't imagine being a physician, a nurse, anything right now during this time. We really appreciate your selflessness during this time and you giving us the information and insight that we need to hopefully make the decisions that are best for us and our families. With that being said, we have a few resources that we put together that speak specifically to our community here in Montgomery County. we'll have this posted on our website also, as well as this entire conversation. But these are some resources we found that have the vaccine available. Every place we looked at requires an appointment, so it's no walk-ins. So make sure you call and set up an appointment for you and your family, and make sure you fall within the criteria or the category. I believe it's category is a B, 1B now. 1B, right. So please be sure to check out the information. Like we said, you know, if you have grandparents, neighbors, godparents, cousins, whomever, that you can get on board, help them, you know, register, identify locations. Instagram has been a valuable tool. I just know personally, you know, make sure you follow the right places. Black Doctors Consortium, they have, you know, resources outside of their own sometimes that they post. So our goal is that together as a community, we heal and that we become healthier. So again, we thank all three for joining us this evening. We thank everybody for coming on board, you know, and indulging in this conversation with us. And hopefully you gain better perspective than what you had when you joined us.
Thank you. Thank you all.
Thank you.
guys.
Have a great evening.
Yeah,
All right, guys.
Good night, everybody.